since this is the corona pandemic times and the corona cases in India are rising, shooting abruptly, and this has extremely baffled the entire medical fraternity. And so today's topic of the discussion, being a doctor, being a medical healthcare professional, I, Dr. Tripathi, is now going to focus on the COVID-19, the very serious and the devastating symptom, that is the happy hypoxia, which is most commonly seen in the younger individuals and which has become a really great threat. So before getting into the condition of hypoxia, the happy hypoxia, firstly, we need to understand the basic functioning of our lungs. So it is our lungs which are the organs which are chiefly responsible for the oxygenation of the vital organs and the cells and the tissues of the body. So when we exhale, whenever we inhale air, the oxygen through the alveoli, it diffuses into the cells and the body tissues. But during the condition of COVID, so see, initially the COVID virus is particularly attacking the upper respiratory tract. Now, slowly and gradually, when the disease progresses to a greater stage, it slowly and gradually goes and affects the entire lung vasculature, the lining of the lung vasculature, the alveoli, they are, for the gaseous exchange, they are lined by thin blood vessels. And these thin blood vessels, they aid in the proper diffusion of the carbon dioxide and oxygen to the cells and tissues. So, during the condition of happy hypoxia, firstly, we need to understand what is actually hypoxia. Hypoxia is a condition, it is a medical condition where it is a scientific term what actually refers to a decreased blood oxygen level. So in such a situation, when the blood oxygen level decreases, there can occur serious symptoms, like there can occur confusion, there can occur shortness of breath, there can occur altered heart rate, and the person may perspire, and there can be increased sweating as well. So these are the initial symptoms, what is most commonly seen as soon as the blood oxygen level drops down. So in patients of hypoxia, as the tissue oxygenation is impaired, so since the signs and symptoms what a hypoxic patient shows, that apart from these systemic manifestations, that is the confusion, the shortness of breath, the altered heart rate, and the sweating. Apart from that, the skin color changes, particularly the lips. They start from the normal skin tone, from the normal pink color, they start appearing somewhat purplish. The extremities, the skin of the hand, from the normal skin tone, they are going to turn somewhat red or blue in color. So these are the conditions what are actually seen in the conditions of hypoxia, where the body tissues are unable to meet the oxygen requirements. So in some conditions, in a normal healthy individual, because this is a corona pandemic times, and the oxygen, it is actually the lungs what is getting affected because of the COVID virus. So in conditions, it is ultimately it is going to impair the oxygenation process of the lungs. And what is going to happen is that when we look at the blood oxygen saturation levels, so for a normal healthy individual, the normal blood oxygen level is round about 95%. All right. So most of the in a normal healthy individual, what do we find is, on an average, the blood oxygen saturation level is round about 95%. But as soon as the blood oxygen level starts declining, the blood oxygen saturation level drops down. If it drops below 80 or even 90, below 90 or 80, there can occur disorientation, because the brain is getting hampered, the oxygen supply to the brain is getting hampered, and that can cause little bit disorientation, and the person may find difficulty in orientation. And when severe blood oxygen saturation level, it is going to drop down to below even 70%, that can ultimately even lead to consciousness as well. Okay. So that can ultimately lead to unconsciousness as well, and the person may faint, the person may start panting because of severe oxygen level deprivation. So there can occur shortness of breath, the patient may start gasping, the patient may have severe respiratory distress can occur. But a medical term, the happy hypoxia, it is mostly very serious and a threatening condition is found in youngsters, because in such a situations when even the oxygen level falls below 80, certain young individuals who are in their teen ages between 20s, and that too the individuals aging between 20 years, 30 years and 40 years, in spite of having an blood oxygen saturation below 80, they are not having any symptoms. They are not showing any symptoms of breathlessness, nor they are getting affected of it. And they are simply scrolling down their phones, they are simply talking, and they are simply having their food and they are enjoying. And as such, they don't find any symptoms. But this is a serious life-threatening condition, because when patients who have low oxygen saturation, they do not feel any symptoms and they are not getting alarmed by this. And since when such an oxygen deprivation has ultimately damaged their lungs to a much severe extent, what it is going to happen is that the disease, when they are being registered in the hospital for the medical healthcare professionals, their condition has become seriously dangerous, and their lungs are severely damaged at that extent, to a greater extent. So this is a serious life-threatening condition been found in the youngsters, and it has become a matter of great concern, and it has caused great threat to these younger individuals, and particularly the cause as to why this happy hypoxia, even when the blood oxygen saturation drops down below 80, and still these youngsters, they don't have any signs and symptoms of breathlessness or any of the COVID symptoms. They are not having any symptoms. The reason, the etiology, what the medical science researchers have found, that it is in the younger individuals that their immunity is very high. Phenomena of this kind of a happy hypoxia is particularly seen in the younger individuals because their immunity is very high. Young individuals, they can withstand some amount of hypoxia and are comfortable even at 81 saturation level. This being the only reasons for being there for their late admissions to the hospitals, because once the oxygen levels drops down to such a condition, it is seriously an alarming condition, and this alarming conditions needs supervision by a healthcare professional, and they need to be hospitalized. So usually the symptoms of breathlessness and discomfort are experienced when the oxygen levels fall below 80. But in cases of happy hypoxia, patient gets alarmed quite late, and there occurs deterioration, and there is little time for treatment, because once such patients, they reach to the emergency department, in the emergency department for their treatment, their condition has been severely deteriorated, and the time span for the effective treatment is very less. They have very less time for the effective treatment because the damage has occurred really severely. So most of the times what we find is that when we look at the older individuals, in a normal healthy young individual, when the normal blood oxygen saturation level is around about 95%, but even older people, the symptoms can be seen even at 92% oxygen saturation, and most vulnerable to this hypoxic conditions, these are the elderly and the immunocompromised people. So elderly and the immunocompromised people, they are at a greater risk of having these hypoxic conditions of COVID-19. And nowadays, the medical researchers have found certain because the new strain of coronavirus, had the second wave of COVID has emerged in the entire world. And now the new symptoms that are being manifested which needs immediate attention. The newer symptoms, what are mostly seen due to COVID-19, it is the rash, the diarrhea, conjunctivitis, joint pains. But these symptoms, they are rarely being considered, and they are not mentioned either in the state or the central government's, Indian central government's or state government's protocol for the RT-PCR testing. So now the newer symptoms what are there, which includes the rash, the diarrhea, conjunctivitis, joint pains, these are nowhere mentioned in the RTPs, in the state government or the central government's guidelines for getting the COVID test done. So these symptoms must be incorporated within the state and the central government guidelines for the protocol for getting the RT-PCR testing done. So furthermore, newer RT-PCR nowadays, even the reverse transcriptase polymerase chain reaction, that is the RT-PCR, is coming negative due to the mutant strain, because now the COVID virus has evolved into a newer strain, and since these newer strains, apart from, in spite of getting the RT-PCR done, certain individuals, they are getting their reports negative in spite of being infected with the newer strain. So when looking at this condition, so this happy hypoxia in this corona pandemic period, we, being responsible citizens, we need to properly, we need to have a proper check on our blood oxygen levels with the help of a pulse oximeter. And even if no symptoms are present, one needs to keep monitoring the blood oxygen saturation level, particularly the youngsters, the youngsters, because they are at a severe threat. Once their oxygen levels falls below 80, they should certainly go and report to a doctor and get their consultations, because the time, but now they could not feel any symptoms even when the oxygen saturation is below 80%, even if they are not having any symptoms, but ultimately they are going to have their lungs severely damaged. So it's a very honest advice to all the youngsters, the teenagers. They should keep on monitoring their blood oxygen level, and in spite of having no symptoms, they need immediate attention. Immediate medical supervision is needed for youngsters and teenagers whose oxygen levels are below 80 and they are having as such no symptoms of COVID. Means that these happy hypoxic youngsters, they need to get immediate medical supervision and assistance, and they need to consult their doctors immediately, because once the lung damage has progressed to a severe state, it will be too late. It will be really, really very late. So students, this is the viewers, this is a very honest advice from my side, and the cause as to what is the basic cause in these younger individuals, what is causing this happy hypoxic conditions. See, the younger individuals, they are more prone to the virus because they are economically active. It is only the youth who is working who is economically active, and so they are more susceptible, they are more prone to get this infection. And all these factors, being economically more active, being more agile, and just because their immunity is very high, even the happy hypoxic conditions, the low oxygen levels below 80% is also just because their immunity is very high, and the oxygen levels below 80% is also not causing any signs and symptoms in them. That actually leads to the risk of severe infections, the severe infection, and seeking medical help late has also means that there can occur more death among youngsters. So please don't take this lightly, and these, if taken lightly, it has been found that these happy hypoxic individuals, now at times the youngsters are even dying very young, because initially they don't have any symptoms, and when the disease has progressed to a much severe state, in a much severe form, then only they are admitted into the hospitals for medical supervision. So this has become a very great cause for the youngsters who are dying. There are more deaths among youngsters due to the COVID-19 strain, due to COVID-19 virus. So last but not the least, I need to conclude by saying that including these alerts, see the newer alerts, what are there, the newer signs and symptoms, what is there is that even a rash, diarrhea, conjunctivitis, and joint pains, they need to be immediately supervised by a qualified healthcare professional, and including these alerts in daily medical bulletin by the state or the central government can cut down the cases of sudden deterioration and death in young individuals. So this video was mainly focusing upon the happy hypoxic individuals who are young. In the corona pandemic period, it is not only the elderly who need to monitor their blood oxygen levels, it is the youngsters, the youth of the country, the youth of India. They also need to be very cautious, and they should keep on monitoring their blood oxygen levels in a shot. Just because once their condition deteriorates, it will be too late, and that can occur majority of deaths among the youngsters as well. So this was a very short video upon the happy hypoxic individuals. Hope you have liked this video. If you like this video, give this video a thumbs up and stay safe, stay protected.